All right, so we have Jenna here. She's been with us for 10 weeks, which is a little bit longer rotation, but I think it went really well. I'm hoping that she learned a lot. So I'm going to kind of ask her some questions so she can give you guys her perspective of what it's like to do a rotation here, what she learned, some of the things that might be a little bit different than she learned in school. So hopefully you get some information out of this. So tell me, for their information, you kind of followed on Instagram for a while before you got here.
Yeah, for probably at least over a year.
Okay.
So I had a general idea that it was going to be different and general idea of what to expect.
Okay. So from your general idea, was it different than you thought it was going to be?
A little bit.
Okay.
I definitely knew I would have to change some of my thought processes, and I think that was some of the hardest part, is getting some of those patterns down and trying to rewire my brain and what to take from traditional therapy and what to change and kind of throw out and say, hey, I need to start looking at it from this different perspective.
Okay. So as far as the process, because you've seen, just like you guys have seen me do cut-ups, like short versions, it's hard to give you a full view of what a treatment looks like in a 1.5 minute clip. So from what you saw of the assessment and the treatment portion of what we do, when you saw that in real life, was that different than what you expected it was going to be?
Yeah, I think it was different in the way that the same streamlined process is what we apply to each patient, and that it works for each patient, and you don't have to rack your brain so much around learning each individual body part and 100 tests and different techniques for each individual body part, and just be able to get really, really good at something that works.
Okay.
And go from there.
Okay. And then, so the first 2-ish weeks you were mostly observation, like watching. I would talk you through what I'm doing, that kind of stuff. So when it came time for me to start teaching you actual NFTs and palpation, how different, like, did it, just give us your feedback on like what you expected, like how hard you were going to have to push with NFTs and how hard you were going to have to dig for palpations. Like, was that what you expected, or was that again different than what you thought it was going to be?
I think it was slightly different. At first, as you know, I was pushing too hard on the NFTs and probably pushing a little too soft on the palpations. So it's a little different, but it's something that's really easy to, as soon as you kind of get the feel for it, easy to keep going with. It doesn't take too long to correct those difficulties that I had at the beginning.
Yep. And she picked up things pretty quick. So typically what we do is students will come in, observe, I talk them through the thought processes, that kind of stuff before we start doing the hands-on. We had to really accelerate things for Jenna because on her 4th week of her rotation-ish is when I had surgery.
Yeah.
I think so.
3rd or 4th?
Yeah. So I told her coming in, hey, guess what? I'm having surgery, and if I can't use my arm, I can't treat people one-handed. So we kind of accelerated things. Fortunately for us, she picked things up pretty quickly, and a lot of it is just breaking some habits from what you learn in PT school as far as pushing really hard for a manual muscle test versus pushing very lightly, like she said, pushing softer than you think you need to because you're just feeling for the facilitation. You're not trying to get gross strength. So fortunately, she had good hands. She picked that up pretty quick. And then she also had the benefit of lab weekend happened like right at the end of her 3rd or 4th week. So she was able to jump in lab weekend for a day and work with people in lab weekend. So that definitely helped speed things up. So now talk about, we had a patient the other day so let's talk about this first. So did it feel like once you got into it after about 2 weeks of having your own patients that you're like, okay, I got this figured out. This makes sense. This is pretty easy, straightforward stuff?
Generally, yes. I still think that there's so much that I still have to go as far as learning and all of the different thought processes and how things can apply to each of the pathologies that I felt were so different from each other, especially when it came to neurologic nerve radicular type of pain. Yeah. And I'm still picking some of that up for sure. I can't say that I know everything. But yeah, circling back, gosh, I'm forgetting what you say. It was easy.
So to feel like you were, once you got in the rhythm, you were like, okay, this is easy, this makes sense, and you're just like cruising through it.
Yeah, I think so. And
Okay.
then I felt pretty confident that even if I didn't quite know exactly what was going on, that if somebody comes in, I can give them stuff that's going to make them feel better by the time they leave.
Okay. So, and that's typical for people that go through the shift and go back after lab week and then are like, oh, I've got this down. And then they get the curveball patient that the presentation they give you in their screen doesn't make sense with what you see on the table. Then you're doing what you think you're supposed to do and it's not working, and the facilitation doesn't come back. And then I could like look across the room and see like Jenna's eyes, like the look of terror. Oh, this, I thought I had it, but this didn't work. And then you start to scramble and like, it's like, okay, so what did I do wrong? What do I fall back on? And then that's when you can only fall back on what you have experience and what you've been taught. So since she hasn't had experience with that happening with another patient, her default is, okay, what did they teach me in school? Or what did, so she had a difficult sciatica patient who had multiple factors feeding into the sciatica stuff. And so she's trying to dig through that. And she came back and said, well, in school, we learned if this happens, or I read a research article that said if this happens, this happens. And I said, okay, so what does that mean for this patient? So then we talked about how the research might say something, school might have said something, but they didn't see that patient. So it's up to you to figure out, you've got that patient in front of you. Now, how are you going to problem solve getting through what didn't work? What do I do next? And how do I keep on moving? So, and if you've been through the shift, you've heard me say this forever, all the time, keep moving forward. Go to the next thing. Like, don't panic, don't change gears, just keep moving to the next thing, keep moving to the next thing. And then eventually something's going to happen where it's like, okay, that worked. Now that made sense why this didn't work, so I go back and I do this. So it's a system of checks and balances where you're always checking your work. So with that patient, what we had to do is I had to kind of like break down for Jenna, okay, so the one thing that patient has a problem with is like getting her knee straight. So she's got a terrible knee. She's got sciatica on that leg. So Jenna noticed, well, her sciatica really kicks up when we do just knee extension on that leg. And then if I turn that into a nerve glide or a nerve mob, that lights everything up. And I said, so after you get done, so take that information, test what you think the muscles are involved in those positions on the table. And then after you do that, go retest the position. So she did that and motion increased. So she actually took out the goniometer, measured it. Motion increased after she did the table work. Motion increased after she did resisted flexion extension at the knee. Nerve pain decreased. Nerve glide, nerve mode positions were getting more comfortable. So then I said, okay, so we haven't done anything functional yet. So get her up and do all your functional stuff and then reassess motion. So every time you check and balance things, you're like, okay, that worked, more motion, more strength. So getting the patient away, and my goal with Jenna was get her away from this mindset that she's got this neurological issue, this sciatic nerve. So I wanted her to stop thinking about sciatic nerve and start thinking about joints and muscles that are involved. And so when she came back and she asked, well, how do we know where the nerve is getting the pressure's getting on the nerve, or how do I know where the nerve's getting caught? And how do I know how to do that? I said, well, you have to go through the whole process, then sit back and take apart your thinking. So it's not think about, okay, where is this getting caught and how I'm going to release that. It's I'm going to trust the process and do the process, and range of motion increased, nerve tension decreased, pain decreased, function increased. So now after I've done that, now I can go back and take apart my thinking and be like, okay, these are the things that I did, which means is probably this problem was coming from this. So it's reverse engineering, not letting the symptom guide your thinking. You trust the process, you do the process, and then you can reverse engineer where it's coming from, which is hard for students because you guys, once again, only know what you've been taught and what you've experienced. So since she hadn't experienced that, and the only thing she has to fall back on is symptom-based thought processes, that's what was getting her confused.
Yeah.
Okay. So now moving forward, you still got another rotation But as you get through into and you get out of school, get into your own career, do you feel like you have a system that has a system of checks and balances so you can like understand what you did, why it worked, and then move forward and problem solve?
Yeah, I definitely think I have a really good foundation for moving forward as I continue to learn those clinical reasoning skills, that I can go back and really pick apart what I've been doing the checks and balances, just like you said, something like a really good foundation to build off of.
Okay. And the thing to remember with Jenna and the students that come through here, I don't give them the shift material. So she has the manual with all of the NFTs and the palpations and all that, but they don't go, and she didn't go through the critical thinking. She didn't go through the neuromuscular review modules. So what I told her is, the reason why you're getting stuck in your processes right now is you haven't gone through the critical thinking module, and the critical thinking is what you don't get in school. So remember, it doesn't matter if you're in high school, undergrad, grad school. School doesn't teach you how to think, it teaches you what to think. So the important part as you go through and you get better and better at things is to take apart your thinking, use critical thinking and reasoning to understand what's happening so you can then move forward with that to do something else. So in 10 weeks, like I said, she went through the accelerated program at the beginning. So she's been seeing probably 7 to 8 patients on her own.
Yeah, I think I saw 11 or 12 today.
Okay,
Yeah.
11 or 12 on her own for the last 3 weeks, pretty much 3 or 4 weeks.
Yeah.
Okay, so that's actually really good. And do you feel like you're getting good results?
Yeah.
Yep. So patients tell me, hey, she's fantastic. She's really good. Is she going to work here? And I keep telling them, no, she's got to go back to another year of school. And then I got to convince her to live in Colorado after that. So even though she doesn't have all of the pieces, I told her the other day, I could take her and stack her up against any other PT student in her class. And I guarantee if I put them both in an outpatient clinic in a setting similar to this, she would crush the other student just because she understands a totally different way of thinking. And I would put her up against any other PT in town too. So I could take her and drop her in any PT clinic in town, and she would outperform the PTs that have 5 years of experience.
Flattering.
Yeah. I didn't tell her that yet, so you're first to hear. Okay. All right. So that's what it kind of sounds like, feels like to go through a rotation here. And I know we're kind of filled up with students, but if you want to do rotation, reach out, let me know, and I can let you know if we have some openings for next year. But again, Jenna did a fantastic job, and I'm hoping she can go back to Angelo State and teach some of her classmates the stuff she learned here and have a fantastic career.
Thank you.
Yep.